I've described what it means to be depressed, how common depression is in the general population, and the health impacts of depression on lifespan. But what exactly is going on here? Why would depression lead to a shorter life? Let's take a closer look first at the mechanism whereby we become depressed and the mechanism whereby depression leads to shorter lifespan and health problems. Why we become depressed is complicated, and there are many factors involved, and it's an area of ongoing and active research. We know that genetic factors play a role. Probably about 1 in 3 cases of depression can be explained by genetic factors. So definitely some, but not the majority. Chronic stress can play a role. We've seen chronic stress rear its ugly head in the past. Chronic stress leads to elevations in cortisol. Cortisol is great in the short term if we're running from a lion or we're trying to fight a bear, but in the long term, it can lead to depression. And that is another cause of depression. Chronic inflammation. We've seen chronic inflammation rear its head as well. Chronic inflammation can lead to depression. Low serotonin. This is an illustration of neurons in the brain. Serotonin is a neurotransmitter. It is responsible for our feelings of good mood. And if it's depleted or lacking in the brain, we can feel depressed. Serotonin needs to cross a synapse, which is just a junction between 2 neurons for it to work. So we have a good experience, we release serotonin, it crosses the synapse, it binds to a postsynaptic or a synapse on the other side, and we experience positive mood. Individuals, it's thought, may have a certain genetic form of the serotonin reuptake molecule. This is a channel that takes serotonin back up into this neuron. We want this to happen, but if this happens too quickly before serotonin has a chance to cross, then serotonin doesn't have time to do its job. So people with depleted or low levels of serotonin or overactive reuptake channels can have depression. And finally, environmental factors play a role. Everything from substance use to childhood trauma is implicated in likelihood of depression. We've seen what can cause depression. What exactly then results from the depression? How can we explain a shorter lifespan, up to 10 years shorter for someone who is depressed? Well, the first thing that comes to mind is it must be suicide. People who are depressed are taking their lives, and this leads to a shorter lifespan. And in the study I referred to that provides the evidence for this recommendation, only 1 in 5 of the premature deaths was attributed to suicide. That means 80% of people have a shorter lifespan but aren't taking their own lives. So what's going on here? 2 things are thought to be involved, 2 pathways. One are lifestyle factors. We know to live a long life and be healthy, we need a healthy diet, regular exercise, we need to maintain a healthy weight, have better sleep, better nutrition, positive attitude, social connection. People who are depressed are less likely to invest in the long-term efforts required by a healthy diet, by exercising, are likely to not have the self-image of someone who can quit smoking or doesn't need tobacco, are likely to be socially isolated. So failure to engage in health-promoting activities is one major reason why people with depression have shorter lifespans. Another major pathway is the quality of health care provided to people who are depressed. People who are depressed are less likely to be up to date with their immunizations, their routine cancer screenings. They're less likely to receive tobacco use counseling. This can be partly explained by the fact that in primary care, we are very limited in the amount of time we have for each patient. And if we are focused on treating depression, that might lead to a unfortunate circumstance of not getting to the preventive services that are important and would be addressed in otherwise healthy people. So we've seen that depression causes not only increased risk of suicide, but even if someone doesn't take their own life, they're likely to have a shorter lifespan and more health problems because of failure to engage in healthy behaviors and less likelihood of receiving preventive services to remain well.